My name's Grace. I am a nurse. I came to Dr. Mo because I was having a lot of problems with my neck, lower back, hip and knee. That was giving me some problems at work, also waking me up in the night. I was waking up with really bad neck and shoulder pain in the night.
Welcome to the Dr. Mo Show. It's been a while since my last video. I've really wanted to make videos sooner. I've been seeing patients for about 6 months now, and I've been extremely busy, and it's all very different now with wearing the PPE and patients wearing masks. So some of the new patients I've been treating for months, I haven't even seen their faces. The other day I was in the gym and a patient came up to me and said, "Hello, I'm embarrassed to tell you that I didn't recognize him because I hadn't seen his full face." In this video, we've got Grace with neck and shoulder pain. You will see how Grace was not able to do some of the movements in her very first visit. I've also asked Grace what home advice I've given her that helped her the most. And I'm going to share that in detail so you can start doing that at home and start improving right now. Let's look at Grace's first visit. Turn your head to the side.
Yeah.
So all opposite pain. Is one side worse than the other?
Her left side's worse.
Yeah, it doesn't go very far on that side. Look down, okay? Any pain?
Yeah, on the back.
Look up to the ceiling.
This is what is the worst.
Okay. Raise your arms sideways, both go together. And stop as soon as you feel any pain.
Both arms are about there.
Both arms are hurting, yeah?
Yeah.
Where do you feel the pain?
So it's from here
In
and down
the shoulder
here.
joints, okay.
Yeah.
In front of you? As high as it can go? Is that it?
Again, they can go further, but it's painful.
Okay. Put the right hand on the left shoulder like this. Keep the base of the palm down and bring the elbow up as high as you can go.
That's okay.
Let me see the range on the other side.
That's much worse.
Yeah. So why see someone now and not sooner?
Because it's getting worse, and I do things like I've been for like physio and sports massage, and normally that makes it better. But it's gotten to the point now where that's not really doing anything. And then since it's been disturbing my sleep, I just think if you don't have enough sleep, then
Yeah,
everything just starts falling apart, doesn't it? So
it does. Just going to feel the vertebrae here, stay nice and on that side. That's okay. That's slightly misaligned there. I'm sure it's uncomfortable when I press on that.
Mm.
So this is okay. This is not okay. You know the difference?
Yeah.
This is okay, not so painful?
Yeah.
Definitely painful.
Yeah.
I suspect this would be tender on
Oh
you.
yeah.
Is that spreading anywhere?
Into my hand.
Okay. So the symptoms might be gone of your hand pain and pins and needles,
Yeah.
but the cause is still there.
Okay.
And that,
Yeah, in my hand.
and that.
Yeah, in my fingers.
Well, that's completely just a quick manipulation. The movement's going to be like that. Okay, it's going to be super fast.
Ooh.
Did it hurt?
No, it felt great.
Right, all done. You can get up, move around, tell me what you notice.
It feels much looser than it has done for a really long time. And in my neck. Ooh, still a bit there, but much better than it was.
Okay, good. Move from side to side, tell me what you notice.
Yeah. Oh, you can actually see behind me. I haven't been able to do that for a long time. I think it's just amazing how quick it all is.
Yeah.
When you go for physio or sports massage, everything takes forever. So it's just impressive.
Raise both arms sideways. Go as high as you can, Grace, without any pain. Stop as soon as you feel anything.
Way better.
That's amazing. In front of you, as high as you can go. Amazing. No pain?
No.
Okay. And left one. Left one on the right shoulder. Keep the palm down. Bring the elbow up as high as you can go. That's amazing. Let's see the right one. Happy days?
Very happy days.
But since coming to Dr. Mo, I feel 100% better. I've only been seeing him for 6 or 7 weeks, and it's made a massive difference. I'm just annoyed at myself that I didn't come sooner.
When I asked Grace what advice helped the most, she said it was reminding herself to hold the phone in the correct position. So traditionally, we hold the phone here. And what that does is moves the head forward and increases the load of the head on the neck here. It also pulls on this bone here. So one of the things that's been helping Grace the most is to hold the phone here. Now that puts the head right on top of the neck. I often tell patients that if they're doing the stretches for 10 to 20 minutes a day, but for the rest of the time, if they're holding the phone down here, they're most likely undoing the effect of those stretches. The other thing Grace said helped her was the towel stretch. All you need to do is roll the towel and put 2 elastic bands on either sides. Then you put the towel at the pointiest part at the base of the neck. And you basically lie down on the floor. It's ideal not to do this stretch in bed because the towel might sink with the mattress and might not be as effective. And you can adjust the thickness of the towel to your comfort, but make sure it's thick enough that your head falls back and gives you a little bit of a stretch like this. You can start this with 5 minutes twice a day and build it up to 15 minutes twice a day. You ideally want to lie with this on the floor, otherwise the towel might just sink into the mattress. If you would like more neck stretches, please watch this video. I'll see you next time.